So people want to know why it's important that we treat these OCDs, and you heard me in the last segment talk a little bit about this. The most important thing is that we don't want damage to other parts of the knee, and this is a repetitive theme in cartilage. If you have a hole, sometimes you can leave it and watch it for a little bit, depending on the size. And a lot of times people have these, either they've been cleaned up or they slowly fragmented over time, and they do pretty well for a while, and generally the tipping point for them is a tear in the meniscus. But let's assume that you've got a large hole there, you're starting to cause some damage to the knee. It is concerning, it's something you want to consider resurfacing or changing that cartilage environment. In this case, the cartilage transplant's an excellent option. We've seen really good success, and honestly is one of the most common reasons for a cartilage transplant. Just because it's a diagnosis of young patients, the OCDs can be found in up to 60 years old. It depends if you have arthritis or not. By the time you're in your 40s, 50s, 60s, whether your treatment options are to replace this cartilage. But if there's reasonable meniscus or meniscus that can be replaced and the reasonable cartilage in the remainder of the knee, this is definitely a good option for a cartilage transplant. And you'll hear about this word OCD thrown out significantly in many different athletes, etc., because generally this is the first stage before they go on to further issues. And sometimes, and a lot of times, if you're diagnosed with an OCD, it can be treated. If you get to the range of arthritis or more problems where other parts of the knee are damaged, there sometimes aren't options for you, and you're talking about different, more aggressive, less sports-oriented options. And this is a similar treatment that Alonzo Ball had, which you can see on our podcast. Well, hopefully this is helpful for you to understand all levels, more advanced levels of OCD treatment, and tune in for more information later.